director of the Department of Ophthalmology in the Tel Aviv Medical Center in Tel Aviv, Israel. And I'm Vice Dean in the Sackler Faculty of Medicine in the Tel Aviv University, Tel Aviv, Israel. My main interest is retinal disease, the treatment and the research of the disease and the management of the patients.
Tell us about the presentation that you made today.
The topic of my presentation today was in patients that have accumulation of fluid in the retina. If we want to treat it with a specific group of drugs that belong to the anti-vascular endothelial growth factor drugs, anti-VEGF drugs, which drug to use and when to use it, and to elaborate on the mechanism that has to do with this particular molecule.
Patients with wet macular degeneration, this is now the standard therapy, anti-VEGF agents. What is the message that you have for patients in terms of the expectations?
Basically, the topic of my talk did not deal so much with macular degeneration, but rather with macular edema from vascular causes. However, I think the answer to this question is very similar for all diseases that have to do with fluid accumulation in the retina. Basically, fortunately, this is something that has developed in the recent 8 years. We have treatments for the patients that have macular edema and fluid in the retina resulting from macular degeneration, diabetic retinopathy, or vascular occlusion. And this is a major, major breakthrough. It's, you can say that it's similar to the fact that until a few dozen years ago, everyone was dying from pneumonia, and now no one dies because there is penicillin. So until 8 years ago, everyone became blind from macular degeneration and severely visually affected by diabetic retinopathy and vascular occlusion disease, whereas now most patients will not get blind and will not be affected by severe vision loss. So this is the major good thing that I have to tell them. Having said that, there are a few issues that show some drawbacks. First of all, that these treatments, be it for macular degeneration or diabetic macular edema or vascular occlusion, this treatment needs multiple frequent visits to the physician's office and basically many injections of intravitreal agent. Doesn't matter which agent it will be. Most patients will need recurrent treatments. So this is one drawback. The other drawback is that still nowadays, even though they will not experience the development of blindness, which has been shown to be reduced significantly since the development of anti-VEGF agents in many countries, they will not experience blindness, and probably they will not experience severe vision loss, but they may still experience over the time, over many years in which they will need treatment, some visual deterioration or stabilization with a slight decline.
Now, in terms of the long-term view, are there anti-VEGF agents in the pipeline that are longer acting and will require less frequent injections? And we're talking about not necessarily every 2 months, but even longer.
Yes, so there are in development a few methods to combat this need for monthly treatments and even monthly visits. First of all, there are slow-release devices that are being developed. And some of the slow-release devices are already functioning. These are mainly for steroids, not so much for anti-VEGF agents. But there are some slow-release devices that also look at anti-VEGF therapy. There is one that I was involved in its development that uses a reservoir that is implanted in the vitreous and is now under development. There is another one that uses encapsulated cells to try and release an anti-VEGF drug slowly. So first of all, there are slow-release devices. In addition, there are drugs that are being now developed and also initially presented by some of the companies that have a longer duration than only 1 month or even 2 months, as we know that some drugs are able to give us 2 months relief, but even longer than that. Basically, these trials are only in phase 1 or maximally phase 1-2 trials, but we do have preliminary results that give promise to our patients and also to us physicians and the system because we find ourselves sometimes in very, very difficult situations that we cannot provide all the help that we need to give to the patients because of the large burden that the system has now, resulting from the need for monthly monitoring and or monthly treatment.
Now, we also heard about the role of steroids injection for macular edema. Is there a role for both VEGF and steroids in combination?
So basically, first of all, we know that steroids have a very important role in the treatment of macular edema resulting from retinal disease, what is conventionally called retinal disease, namely diabetic macular edema and macular edema resulting from vascular occlusion. Unfortunately, for macular degeneration, steroids thus far have not been shown to be very beneficial. For diabetic macular edema and retinal vein occlusion, there is very good evidence for at least 2 or even 3 steroids that are very effective in this treatment. Some of them have been shown to be more effective in the long run, namely in very chronic disease, and some of them also in short-term disease. So definitely they have a role. If you ask about the combination, there is very little data. Some data did show that there may be a beneficial effect to the upfront use of a steroid with an anti-VEGF. Currently, for myself in my practice, I usually do monotherapy, and I only add combined therapy if it's a very resistant patient or a patient that needs a lot of treatments. Then I would think that maybe a combination can lower the number of treatments he may need.
Let's switch gears talking about EVA. Tell us a little bit about EVA and its role in fostering ophthalmological research in Europe.
So I think the main importance of this meeting is the fact that it combines in a very special way basic research with translation to clinical world. I think it's almost maybe the only meeting that combines researchers and physicians in a way that they have time to talk, because in other meetings, there are meetings that do a lot of basic research, but they're based basically on posters and not so much on presentations and discussions. The EVA focuses on interaction, both among basic scientists, among physicians, and between the two groups. And I think it's very special. What I really like about EVA is that sometimes there is a focus on a very specific topic that is just part of a disease. For example, the session that we just had now on fluid accumulation. Fluid accumulation combines so many diseases and is part of so many diseases, and at the same time, the EVA gave us the platform to present where it comes from, then how to treat it, and what are the debates that we still have regarding this disease.
What about funding of research for eye diseases in Europe?
So I think there is now a major issue with funding all over the world and also in Europe. I know that all the grants, the competitive grants, are much more difficult to achieve. Some of them do not have the same resources that they used to have in the past. Still, I think that there is room to try and have collaboration between various European countries and try and find resources that will want to do to support such a collaborative effort that can help the European community.